12 weird signs that you have liver damage. In today's video, we are going to discuss some early signs that might indicate liver damage. Knowing these signs can be crucial, as it can allow you to take proactive steps to stop its progression from getting worse. The liver has the ability to heal itself if taken care of properly. According to statistics from the American Liver Foundation, 25% of adults in the USA are affected by liver disease. Despite what many people think, excessive alcohol consumption isn't the only cause of liver damage. There are other factors that can also lead to liver damage, such as eating processed foods, consuming too much sugar and vegetable oils, taking too many painkillers, and viruses. If you would like to know if there are any problems with your liver, watch this video through to the end, as we will also discuss some natural home treatments to clean the liver and prevent further damage. Signs of liver damage 1. Pale stool. Pale stool can be a sign of liver damage. When we eat food, our liver produces bile to digest foods and fats in it, giving the stool its normal brown colour. But when you have a damaged or fatty liver, it can hinder the flow of bile through the bile ducts. This changes the colour of the stool, making it lighter, paler, or clay-coloured. Due to the indigestion of fats, your stools can become buoyant, causing them to float on the surface of toilet water. Do not ignore these signs and consult a medical professional as soon as possible. 2. Nyctalopia, poor night vision. Poor night vision, or nyctalopia, can be another sign of a damaged liver. It is a condition where an individual has difficulty seeing in low light or darkness. The liver's duty is to filter toxins and produce proteins, including one called retinol-binding protein, which transports vitamin A to the retina. When the liver is damaged, it can lead to a deficiency of vitamin A, which affects the cells in the retina responsible for low-light vision. If you're experiencing poor night vision, it is important to see a doctor, as it may indicate liver damage. 3. Swollen right foot. Liver damage can lead to a condition called peripheral edema, which is the swelling of tissues, usually in the legs and feet. When the liver is damaged, it may fail to produce enough albumin, a protein responsible for maintaining fluid balance in the body. This imbalance can cause fluid to accumulate in the lower extremities, leading to swollen feet, particularly on the right side due to the way blood flows through the body. Before moving on, if you are enjoying the video so far, make sure you subscribe to our channel so you never miss any of our latest videos. 4. White or yellow bumps around the eyelids. Another weird sign of liver damage is when you start seeing white or yellowish growths around your eyelids. These little bumps around the eyelids are cholesterol deposits known as xanthelasma. When someone has a liver condition, the liver stops breaking down cholesterol and instead starts building it up in different parts of the body, including the eyelids. Xanthelasma could be a sign of liver disease, so please don't ignore it and have a liver checkup as soon as possible. 5. Right-sided pressure. Another noteworthy sign indicating potential liver disease is the sensation of pressure or discomfort on the right side of the rib cage, especially after eating. Basically, the bile produced by your liver becomes thick and sludgy due to liver damage, which then blocks the small ducts connecting to your gallbladder. This sludge buildup puts pressure on your ribs and can even affect your phrenic nerve, causing muscle tightness and discomfort in your right shoulder. It's important to recognize these sensations as possible signs of liver problems so that you can seek help before it's too late. 6. Purple or red bumps on skin. According to medical science, a damaged liver is not able to produce proteins such as fibrinogen, a key component of the coagulation cascade, which is important for blood clotting. This means that you can bruise easily and more often, resulting in unusual purple and red spots or bumps appearing as a rash on the skin. These are mostly observed around the lower legs and arms. Sometimes they are caused by poor blood circulation, which is also a sign of liver disease. 7. Cracked heels. Cracked heels can be a sign of a damaged liver. Our body uses vitamin B3, also known as niacin, to keep our skin moisturized, smooth and strong in order to protect it from damage. However, when our liver is damaged, it uses up all the stored vitamin B3 in an attempt to repair itself. This deficiency of vitamin B3 leads to cracking of the feet, heels and foot soles. Do not ignore this small sign, as it could indicate a damaged liver. 8. White or swollen nails. White or swollen nails could indicate serious liver damage or an underlying health issue that affects the oxygen supply to the nails. A study conducted in the 1950s revealed that 8 out of 10 individuals with severe liver scarring had completely white nails, demonstrating a strong correlation between nail appearance and liver health. Clubbed nails, characterized by round and enlarged fingertips, may also be a sign of chronic hypoxia, often associated with liver diseases such as cirrhosis. Monitoring changes in nail appearance, along with other symptoms, can help in the early detection of liver-related problems. 9. Dark urine. If the colour of your urine is dark yellow or brown, it is a symptom that your liver may be damaged. The liver plays a vital role in filtering and processing waste products from the blood, including bilirubin, a yellow pigment that gives urine its colour. When the liver is damaged, it may not be able to filter bilirubin properly, causing it to build up in the body and giving urine a darker colour. This can be a sign of various liver conditions such as hepatitis, cirrhosis, or liver cancer. 10. Jaundice. Jaundice is a significant symptom of a fatty liver. It occurs when there is an excessive buildup of bilirubin, a yellow pigment produced during the breakdown of red blood cells in the bloodstream. In a healthy liver, bilirubin is efficiently processed and excreted. However, when the liver is compromised by fat accumulation, its ability to process bilirubin is impaired, leading to its buildup in the body. This causes yellowing of the skin, eyes, and mucous membranes, giving rise to the characteristic symptom of jaundice. 11th. Spider veins. Spider veins, also known as telangiectasias, are small dilated blood vessels that appear close to the surface of the skin. They often form a web-like network of red, blue, or purple lines, hence the name spider veins. These veins are commonly found on the face, legs, and feet, and may indicate an underlying liver condition. When the liver is damaged, estrogen levels become elevated, which can result in increased pressure in the veins, causing them to become visible. Spider veins can also be a sign of other liver conditions, such as cirrhosis or hepatitis. 12th. Itchy skin. Itchy skin is a common symptom of liver damage. This condition is caused by a buildup of bile acids under the skin because the liver is not filtering them out properly. This causes histamines to build up in the blood, triggering the itchy reaction. This can lead to dry, flaky skin, which can also contribute to the itching sensation. If you have any of these symptoms that we have mentioned above, you might want to visit your doctor and get your liver examined via an ultrasound test to see if you have a damaged liver. How to reverse liver disease. How can we reverse liver damage? Liver damage occurs in 4 stages. At first, excess fat builds up in the liver cells, leading to inflammation and the development of scar tissue called fibrosis. If not stopped at this stage, it can lead to permanent scarring of the liver, also known as cirrhosis, which is the most dangerous stage and results in liver failure. Fortunately, the liver has the ability to completely heal and regenerate itself with proper diet and other remedies. So, let's delve into the most important steps you can take to heal your liver. Start drinking organic coffee in the morning, and instead of adding sugar, add half a teaspoon of turmeric to it. The phytonutrients in turmeric and polyphenols in coffee help reduce scar tissue formation and repair damage caused by drugs, alcohol, and fructose. Drinking at least 1 litre of water daily can help thin out the blood and aid the liver in producing bile to break down fatty deposits. It is recommended that you incorporate as many liver-cleansing herbs and spices into your diet as possible, such as ginger, turmeric, cinnamon, dandelion, root, milk thistle, reishi mushrooms, green tea, and cloves. Eliminate inflammatory seed oils from your diet, including corn, cottonseed, canola, rapeseed, soy oil, margarine, and low-quality processed olive oil. These oils can contribute to liver inflammation and damage. Replace them with anti-inflammatory fats like butter, tallow, extra virgin olive oil, and coconut oil in your home-cooked meals. These healthier alternatives not only enhance the flavour of your dishes, but also provide liver protective properties. Incorporate sulfur-rich foods into your diet, such as leafy greens, arugula, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pasture-raised eggs, oily fish, walnuts, onions, scallions, and broccoli sprouts. These foods elevate glutathione levels, aiding in liver detoxification and fat removal. Their sulfur content supports the breakdown of toxins, promoting overall liver health and function. Regular consumption of these nutrient-dense options helps combat fatty liver disease and enhances the body's natural detoxification processes. Stop eating processed and sugary foods. To reverse liver damage, you must cut back on sugary, starchy, and flour-based foods such as bread, biscuits, sweets, ketchup, pancakes, pasta, soda drinks, etc. A fatty or damaged liver is sensitive to fructose, fruit sugar, in the same way it's sensitive to alcohol, so it's important to stop drinking fruit juices and alcohol entirely. That's how we can start the journey of curing the liver. Take purified bile supplements such as TUDCA, tauroursodeoxycholic acid, purified bile salts, or digestive enzymes containing ox bile. These supplements are particularly effective when taken in the morning on an empty stomach and can eliminate fat from the liver and prevent the formation of gallbladder stones. Consulting with a healthcare professional can help determine the most appropriate supplements for individual liver health needs. Practice intermittent fasting. It is a great way to give your liver a break and keep it healthy. It helps reduce liver fat, improve insulin sensitivity, and lower inflammation. Plus, it triggers a cleansing process that gets rid of toxins in your liver.